I'm Mear. I'm Chief Executive of the Innovation Agency. Before I came into this role, I was Chief Executive of a hospital in Liverpool. I've worked in a number of NHS trusts. I've worked in a mental health trust, I've worked in an acute trust, worked in an ambulance trust, a care trust and a tertiary trust. Before that, I was a management consultant working across England, and previously to that I had a 17-year career in local government, and at the end of that career for the last 6 years I was running the customer service centres for 3 councils: Kirklees Council, Oldham Council and Rochdale Council. The structure of the Innovation Agency is quite clear. We've built it up over a number of years. So we have an executive team and we're responsible for the strategic planning of the business, but we do that in conjunction with colleagues right across the Innovation Agency. We have 2 all staff away days every year where we look at strategy and we look at how we move forward. Now sometimes the executive team, you might wonder where we are, but our job is to be out there, to be networking, to be in local, regional and national organisations, dealing with politicians, dealing with decision makers so that we can influence innovation across the country. We have a commercial team, and our commercial team support businesses. They help them to develop the products, get funding, match them with partners in an NHS or a local government setting. So again, they're out and about in the patch, meeting with people and matching them up with partners in our sector. We have a transformation team, and their role is to work with local partners to adopt and spread innovation, so they match our innovations into needs of the system and work with people to understand what is an innovation, how might I deploy it, and what does it mean for me in terms of changing work practices, and what will be the fantastic outcomes for our residents and patients. We have a culture change team, a small team of 3 people, but they do some fantastic work with local organisations in helping them to think about how they can create a culture for innovation to thrive. We also have a brilliant comms and engagement team, and they work with our stakeholders, they work with our staff to plan fantastic events, to look outside of the Innovation Agency and think about what might interest people. So they'll be writing articles for newspapers, they'll be supporting you to write blogs, they put out a newsletter to all our residents, and we have a weekly internal newsletter called Connect that you'll see, and the comms and marketing team prepare that newsletter. And we have a fantastic patient safety team, and they work with NHS Improvement to put practices into place that help trusts and local authorities to make sure they're safe when they deal with their residents who are coming through the doors. And all our agendas will change over the coming years with our licence. We respond to the needs of the system and we find innovation that matches that need. We're very proud that we've got the Investors in People Gold Award, and we've held that for some time, and that means that we really value the processes and procedures that are in place to support staff in their development. So you'll be having regular appraisals and one-to-ones. We put on regular training sessions, and you might go on some external training, and we try to look after the health and welfare of all staff, and that's been evidenced by us achieving the IIP Gold Award.